Respected audience, Assalamu alaikum. I welcome all in today's 38th lecture on pathology. Today, day 4 of Neoplasm. Today's topic Anaplasia and anaplastic cell. Anaplasia and anaplastic cells. Premalignant conditions and childhood malignant neoplasm. Dear audience, in day 3 lecture on neoplasm, I have told you about the differences between benign and malignant neoplasm, locally malignant neoplasm, differences between carcinoma and sarcoma, what is carcinoma in situ, what is invasive carcinoma. Today first come to anaplasia and anaplastic cells. First, we have to know what is anaplasia. Anaplasia means lack of differentiation is known as anaplasia. Lack of differentiation is known as anaplasia. Dear audience, we can recapitulate what is differentiation. Differentiation means extent of resemblance or extent of similarities of tumor cell with the normal cell. Extent of resemblance or extent of similarities of tumor cell with the normal cell is known as differentiation. If there is lack of differentiation, then it is called anaplasia. And the cell with lack of differentiation is known as anaplastic cells. Now come to characteristics of anaplastic cells. Characteristics of anaplastic cells. Again, lack of differentiation is called anaplasia, and the cells with lack of differentiation is called anaplastic cells. Cells are pleomorphic. That is, the anaplastic cells are of different size, different shape, different size and different shape of nucleus. So if these are the tumor cells or malignant cells, some will be small size, some will be large, some will be irregular shape with large hyperchromatic nucleus, prominent nucleoli, alteration in nuclear cytoplasmic ratio. So these are the neoplastic cells and these are the anaplastic cells and these are the malignant cells. Different size and different shape. So cells are pleomorphic. If we consider single anaplastic cell. Large cell with large hyperchromatic nucleus. So large cell with large hyperchromatic nucleus when we consider single anaplastic cell. Altered nuclear cytoplasmic ratio. In the previous lecture, I have told you in normal cell, the nuclear cytoplasmic ratio is 1:8. Normal cell, nuclear cytoplasmic ratio is 1:8. Suppose this is normal columnar cell, nucleus like this. So nuclear volume is smaller than the volume of cytoplasm. If it is an anaplastic cell and if it is a malignant cell, the nucleus will be large and hyperchromatic, cytoplasm will be minimum, so there is alteration of nuclear cytoplasmic ratio and the ratio becomes 1:1. So what is the alteration? The ratio becomes 1:1. That is NC ratio becomes 1:1. Why? It is due to large nucleus. It is due to large nucleus. So if you consider this is a malignant cell, and if this is the nucleus of the malignant cell, that is the nucleus of the anaplastic cell with prominent nucleoli. So this is cytoplasm, this is nucleus. So there is alteration of nuclear cytoplasmic ratio and the ratio becomes 1:1. Prominent nucleoli, that is conspicuous nucleoli. So this is the prominent nucleoli. Abnormal mitosis. So these are the characteristics of anaplastic cells. Pleomorphism, large and hyperchromatic nucleus, large cell, altered nuclear cytoplasmic ratio, prominent nucleoli, abnormal mitosis. These are the characteristics of anaplastic cells, characteristics of the malignant cells. Dear audience, if we want to know what are the characteristics of single anaplastic cell, what are the characteristics of single malignant cell? Characteristics of single anaplastic cell, that is characteristics of single malignant cell. Single malignant cell, large cell, large and hyperchromatic nucleus, altered nuclear cytoplasmic ratio, that is altered NC ratio, prominent nucleoli, abnormal mitosis. These are the characteristics of single anaplastic cell, characteristics of single malignant cell. Suppose this is a malignant cell, large cell with large hyperchromatic nucleus. So alteration in nuclear cytoplasmic ratio, and that is permanent nucleoli. So these are the characteristics of single anaplastic cell, characteristics of single malignant cell. If we want to know the characteristics of anaplastic cells, then there will be pleomorphism of the cells first. Dear audience, now come to growth characteristics of anaplastic cell or malignant cell in artificial culture media. Growth characteristics of anaplastic cell or malignant cell in artificial culture media. Dear audience, if we culture malignant cell in artificial culture media, what characteristics we can get? Loss of contact inhibition. The first and foremost characteristics of malignant cell in artificial culture media, loss of contact inhibition. Reduced serum requirement. Reduced serum requirement for survival of anaplastic cells. Cells are immortal. Cells never maturate. Cell can grow. Cell can grow in liquid media. So these are the characteristics of anaplastic cells in artificial culture media. These are the growth characteristics. Loss of contact inhibition, reduced serum requirement for survival, cells are immortal, cells never maturate, cell can grow in liquid media. First come to loss of contact inhibition. Dear audience, suppose this is a solid media. This is another solid media in petri dish. Suppose this is the media with serum. Media with serum. This media for normal cell, and this is for anaplastic cell. If you allow normal cell here to grow, and if you allow anaplastic cells here to grow, what will happen? Again, if normal cell is allowed in this media to grow, if anaplastic cells is allowed here for its growth, what will happen? the cell undergo multiplication. In case of normal cell, what happens? In normal cell, what will happen? The cell will multiply. Cell will multiply like this. Cell will multiply, and during multiplication, when the normal cell come in contact, their further multiplication is inhibited. Again, during multiplication of normal cells, when the cells come in contact during multiplication, the multiplication is inhibited. This is known as contact inhibition. What is it? During multiplication in artificial culture media, when the normal cells come in contact, the multiplication is inhibited. So during multiplication, in case of normal cell, in the artificial culture media, when the cells come in contact, their multiplication is inhibited. This is called contact inhibition. This is called contact inhibition. It is present in case of normal cell in artificial culture media. But if we grow anaplastic cell in artificial culture media, what will happen? The cell will multiply, and when the anaplastic cells come at contact, there will be no inhibition of multiplication. Rather, multiplication will continue. In case of anaplastic cells, during multiplication, when the anaplastic cells come at contact, there will be no inhibition of multiplication. So, in case of anaplastic cells that are allowed in culture media to grow, during their multiplication, when the cells come at contact, there will be no inhibition of multiplications of the cells. This is known as loss of contact inhibition. This is known as loss of contact inhibition. This is loss of contact inhibition. Again, in case of normal cell, when the cell come in contact, multiplication is inhibited. This is contact inhibition. But in case of malignant cell, when they come in contact, there will be no inhibition of multiplication. So this is loss of contact inhibition. Dear audience, you know neoplasm is nothing but abnormal mass. As the malignant cell continues to grow after coming at contact, so there is formation of abnormal mass. Now come to reduced serum requirement for survival. Dear audience, in these two media, same amount of serum is given. Same amount of serum is given. Same amount serum is given. Here also same amount of serum is given. After few days, if we observe, what we will see, after few days, the serum will be finished and all cells will die. But in case of anaplastic cell, the cell may die, but after a long time, because although in this culture media same amount of serum is given, but the malignant cells or anaplastic cells die or degenerate after a long time. Why? Because the anaplastic cells require minimum serum for survival. But in case of normal cell, sufficient amount of serum is required for its survival. Dear audience, now come to malignant cell never maturate. If you consider the culture media for the normal cells, after few days you will see some cells are young, some cells are old. If you consider the culture media for the anaplastic cells, you will see all the cells are more or less immature. It indicates anaplastic cells never maturate. Another one is anaplastic cells are immortal. Anaplastic cells are immortal. If you consider the media for the normal cells, after few days you will see all cells degenerate because of finishing of serum. If you consider the culture media for the anaplastic cells, after few days you will see the all anaplastic cells are immature and there is no degeneration of the anaplastic cells. Why? As anaplastic cells requires minimum serum for survival, so it can survive for a long time. So these are the immortal. So anaplastic cells are immortal. Now come to anaplastic cells can grow in liquid media. Anaplastic cells can grow in liquid media. Dear audience, if you consider this is liquid media, another liquid media, with serum. And if you allow normal cells to grow here, normal cells, and if you allow anaplastic cells here to grow, anaplastic cells, what will happen? In the liquid media, normal cell cannot grow, it will degenerate. But in liquid media, malignant cell can grow. Why? Normal cell requires anchorage for its multiplication, for its growth, and so it can grow in solid media. Normal cell cannot grow in liquid media. Why? To grow, normal cell requires anchorage, so it can grow only in solid media. Normal cell requires anchorage for its growth in solid media. So normal cells requires anchorage for its growth, and so it can grow in solid media. As it does not get any anchorage in the liquid media, so it cannot grow in liquid media. But malignant cell or anaplastic cells requires no anchorage, so it can grow in solid media, and also it can grow in liquid media. Dear audience, we know accumulation of excess fluid in the peritoneal cavity is ascites, and there are so many causes of ascites. If ascites is due to intra-abdominal malignancy, if ascites is due to intra-abdominal malignancy, in the ascitic fluid we can get exfoliated cell from the intra-abdominal malignancy, and we can get shaded cell from the peritoneum. Again, if anybody suffers from ascites following intra-abdominal malignancy, the malignant cell may exfoliate from the malignant tumor in the ascitic fluid, and mesothelium from the peritoneum may shed in the ascitic fluid. If anybody suffers from ascites following intra-abdominal malignancy, if anybody suffers from ascites following intra-abdominal malignancy, what will happen? Malignant cell or anaplastic cell may exfoliate in ascitic fluid from malignant tumor, and mesothelium may shed from peritoneum. So in this case, if we analyze the ascitic fluid, we will get anaplastic cells, at the same time we will get mesothelium. If we analyze the ascitic fluid, we will see the mesothelium all degenerates, or we will see the mesothelium shaded from the peritoneum present in the ascitic fluid are degenerated, but the exfoliated malignant cells from the malignancy are not degenerated. So mesothelium seen degenerated, exfoliated malignant cell or exfoliated anaplastic cell seen not degenerated. It indicates the malignant cells or anaplastic cells that are exfoliated from the malignancy in the acidic fluid can grow, can survive, because it can grow in liquid media. Acidic fluid here is liquid media for the malignant cell, also for the shaded mesothelium. But in this acidic fluid, the malignant cells survive, so it does not degenerate, but the shed mesothelium cannot survive, so it degenerates. So we can recall again, anaplastic cell can grow in liquid media, but normal cell cannot grow in liquid media. So loss of contact inhibition, reduced serum requirement for survival, cancer cell or malignant cell or anaplastic cell never maturate, they are immortal and they can grow in liquid media. These are the growth characteristics of anaplastic cells in artificial media. Now come to premalignant conditions. Solar keratosis, Barrett's esophagus, chronic atrophic gastritis, dysplasia, ulcerative colitis, Xeroderma Pigmentosum, multiple polyposis coli. These are the different premalignant conditions. Solar keratosis that occurs in skin, Barrett's esophagus that occurs in the lower end of esophagus, chronic atrophic gastritis, dysplasia, ulcerative colitis, Xeroderma pigmentosum, multiple polyposis coli. First come to Barrett's esophagus. Dear audience, if this is the esophagus and this is the stomach, and this is the lower end of esophagus. Dear audience, if there is repeated gastric reflux in the lower end of esophagus, what will happen? Repeated reflux of gastric content in lower end of esophagus. What will happen? We know the esophageal lining epithelium is stratified squamous epithelium, and the lining epithelium of stomach is columnar epithelium. The columnar epithelium of stomach can tolerate hydrochloric acid, but lower end of esophageal lining stratified squamous epithelium cannot tolerate hydrochloric acid. If there is repeated reflux of gastric content from the stomach to lower end of esophagus, there will be metaplasia due to chronic irritation. The squamous lining of lower end of esophagus will be replaced by gastric columnar or intestinal like columnar. If there is columnar metaplasia in the lower end of esophagus, then that esophagus is known as Barrett's esophagus, according to name of scientist Barrett. There are many complications of Barrett esophagus. There may be peptic ulcer, there may be stricture, there may be esophagitis, and there may be esophageal carcinoma. So Barrett's esophagus is one of the pre-malignant condition. Dear audience, now come to chronic atrophic gastritis. Suppose this is the stomach. If anybody suffers from chronic atrophic gastritis, what will happen? There will be decreased secretion of hydrochloric acid and decreased secretion of intrinsic factor of Cassel from the parietal cell or oxyntic cells of the gastric gland. As there is decreased hydrochloric acid secretion, what will happen? There will be decreased acidity. And due to decreased acidity, there will be growth of Helicobacter pylori. Due to decreased acidity, Helicobacter pylori will grow. And this Helicobacter pylori acts upon the nitrates and nitrites and converts it to nitrosamine. Acts upon nitrates and nitrites and conversion of nitrates and nitrates to nitrosamine. And this nitrosamine is carcinogen and it causes gastric neoplasm and it causes gastric carcinoma. So chronic atrophic gastritis is one of the pre-malignant conditions. Now come to dysplasia. What do you mean about dysplasia? Dysplasia means disorder of growth. Means disorder of growth. That is atypical alteration in size, shape and orientation of cell is known as dysplasia. Atypical alteration in size, shape and orientation of cell is known as dysplasia. So it is disorder of growth where there is atypical alteration in size, shape and orientation of cell. Dear audience, if you consider this is the dermis and this is the epidermis. You know, in epidermis there is different layers of cell. And this is the basal cell. If there is dysplasia, what will happen? There will be atypical alteration in cell size, cell shape and orientation of the cell. And how can we recognize dysplasia under microscope? That is the characteristics of the dysplasia. One is basal cell hyperplasia. There will be basal cell hyperplasia. Another is thickening of lining cells. There will be thickening of the lining cells. Another one is presence of mitotic cells in all layers. Presence of mitotic cells in all layers. So these are the characteristics of dysplasia. Basal cell hyperplasia, there is acanthosis, or that is thickening of the epidermis, and presence of mitotic cells in all layers. This is the dysplastic change or dysplasia. There are three grades of dysplasia. Grade 1, when inner one-third is dysplastic. Grade 2, when inner two-third is dysplastic. Grade 3, when full thickness is dysplastic. So dysplasia means atypical alteration of cell size, shape and orientation. In dysplasia, there is basal cell hyperplasia, acanthosis and presence of mitotic cells in all layers. Three grades of dysplasia. Grade 1, what it means? This atypical alteration in size, shape and orientation of cell in the inner third of the lining cells. Inner third shows dysplasia. Grade 2, what it means? Inner two-thirds shows dysplasia. Grade 3, what it means? Full thickness dysplasia. So dysplasia is one of the pre-malignant conditions. Dear audience, now come to Xeroderma pigmentosum. It is one of the chromosomal breakage syndrome. It is one of the chromosomal breakage syndrome. Dear audience, now come to chromosomal breakage syndrome. What we mean about chromosomal breakage syndrome? Dear audience, when we expose to light, you know, DNA undergo damage. Again we come back from the bright light to dim light. The damaged DNA is repaired by endonuclease enzyme. On exposure to light, that is bright light, DNA undergo damage, and this damaged DNA is repaired by endonuclease enzyme. Damaged DNA is repaired by endonuclease enzyme. If there is deficiency of such type of enzyme, if there is deficiency of this enzyme, what will happen? The damaged DNA will not be repaired. If there is deficiency of the enzyme, what will happen? No repair of DNA. If there is no repair of DNA, this is known as chromosomal breakage syndrome. Dear audience, you know chromosome is composed of DNA. So if no repair of DNA, what will happen? There will be chromosomal breakage syndrome. And this chromosomal breakage syndrome consists of, one is Xeroderma Pigmentosum, another is Ataxia telangiectasia. Xeroderma pigmentosum, Ataxia telangiectasia, Fanconi's anemia, Bloom syndrome. So these four under chromosomal breakage syndrome. Here Xeroderma pigmentosum is one of the chromosomal breakage syndrome, and Xeroderma pigmentosum is one of the premalignant conditions. If anybody suffers from Xeroderma pigmentosum, there is chance of development of, if anybody suffers from Xeroderma pigmentosum, there is chance of occurrence of cutaneous malignancy. Dear audience, now come to childhood malignant neoplasms. What are the malignant neoplasms that occurs under the age of 18 years? These are childhood malignant neoplasms. Leukemia, blood cancer. What type of leukemia occurs in childhood? Acute leukemia. Dear audience, acute lymphoblastic leukemia and acute myeloblastic leukemia both occurs usually under the age of 18 years. Both occurs in childhood. Among these two, most common is acute lymphoblastic leukemia in childhood. Commonly acute lymphoid leukemia. Retinoblastoma, that occurs in the retina. Medulloblastoma. Medulloblastoma is one of the brain tumor that occurs in childhood. Hepatoblastoma. Nephroblastoma. Nephroblastoma occurs in kidney. It is known as Wilms tumor according to name of scientist. It is called Wilms tumor. Neuroblastoma, rhabdomyosarcoma, dear audience, rhabdomyosarcoma, you know, malignant neoplasm of skeletal muscle. It occurs usually under the age of 18 years, that is usually it occurs in childhood. Nasopharyngeal carcinoma, NPC, nasopharyngeal carcinoma, it occurs in childhood. So these are the different childhood malignant neoplasms. Acute lymphoblastic leukemia commonly among the leukemia, retinoblastoma, medulloblastoma, hepatoblastoma, nephroblastoma, neuroblastoma, rhabdomyosarcoma, nasopharyngeal carcinoma. Dear audience, today I have discussed briefly about anaplasia and anaplastic cells. It means lack of differentiation is called anaplasia, and characteristics of anaplastic cells: pleomorphism, large and hyperchromatic nucleus, nuclear cytoplasm ratio altered, prominent nucleoli, abnormal mitosis. If we want to know characteristic of single anaplastic cell, you have to start from the large cell, large and hyperchromatic nucleus, altered NC ratio, prominent nucleoli, abnormal mitosis. And I have discussed briefly about the growth characteristics of anaplastic cells in artificial culture media. One is loss of contact inhibition, reduced serum requirement for its survival, malignant cell never maturates, they are immortal, and they can grow in liquid media also. I have told you briefly about the different pre-malignant conditions: solar keratosis, Barrett's esophagus, chronic atrophic gastritis, dysplasia, Xeroderma pigmentosum, ulcerative colitis, multiple polyposis coli, etc. Lastly, childhood malignant neoplasms. Dear audience, today up to this, thanks all.